A hearty good afternoon to everyone and welcome to our session on the topic of recurrent implantation failure. And we are pleased to have Dr. Shweta Gupta among us to educate us on this topic. Implantation failure can be caused by a variety of circumstances, including uterine anomalies, hormonal or metabolic diseases, infections, immunological factors, and more. We are happy to have Dr. Shweta Gupta among us to shed some light on this topic. Doctor, you have the stage.
Yeah, thank you, Sean. So it's a very interesting topic, a recurrent implantation failure. And as we understand from the name, so these are the patients who had three or more implantation failure, and we label it as a recurrent implantation failure. We also look into the quality. So if you had a four good quality embryo transfers, especially if it's under the age of 40, then we label it as recurrent implantation failure. It's a complex problem with a wide range of causes, different etiologies, and the mechanisms, as well as there are different types of treatment options. So, if we look into the implantation as a process, there are three things which are very important. One is the embryo, which is the most important. But apart from that, we have the endometrium. What we call endometrium is the inner lining of the womb, and the third is the synchronization between the embryo and the endometrium. So these three things, if it happens perfectly, that gives us a good pregnancy, positive pregnancy result. But if anything is a problematic, then it leads to implantation failure. So if we look into the causes in detail, there could be anatomical causes, like there can be a problem in the uterus. So there could be a polyp or myoma or adhesions which are in on the inner lining of the womb, and that can affect the implantation. Also, if the lining is very thin, and there are some adhesions, so there's not enough space or room for the implantation. So these problems can cause to recurrent implantation failure. The second very important cause is genetic. So if the embryo which we are putting in is not genetically normal, then it can really lead to implantation failure. Now, usually what we do in our labs, that we culture embryos, and we usually like to go up to the day 5. So the blastocysts, they are the best, they have the best potential of giving the maximum success rate. So what we expect, or what we want at the end of the IVF, is a competent blastocyst. But when we look in the lab under the microscope, what we do a morphological grading, where we only look into the different category or different grading of the embryos. If we go a step further, then we can also get a genetic testing, and we can look into whether there are some chromosomal abnormalities. So the what we want, that the particular embryo which we have selected should be also chromosomally normal. So in majority of the cases where we have implantation failure or recurrent miscarriages, it has seen that it could be because of the chromosomal abnormalities, which may be of different types: translocation, mosaicism, inversions, deletions. So these problems are quite common in the cases of recurrent implantation failure. Then there can be causes which are immunological, where there are sometimes natural killer cells or cytokines, or there are some autoimmune antibodies. These are antinuclear antibodies, and they are involved in the biochemical pregnancy loss. There are also antiphospholipid antibodies. Apart from these immunological, there can be infections. There are different types of infection which can cause implantation failure. So, when we look into the therapeutic interventions or the treatment options, it depends upon what particular problem we are diagnosing in that particular case. So, if we look into all the treatment options, the first is the most is the general lifestyle. The patient should have a right BMI. It is very important that she should not be too obese, or too the BMI should not be too less also. So the right BMI increases the fertility potential and the success rate. Also, like smoking, or if there is a continuous stress, then that can also cause a reduced implantation rate. So, if we look into the different specific treatments of recurrent implantation failure, then the embryo is very important. If we feel that our embryo is suboptimal, then we have to either look into the ovulation induction protocol, or we have to sometimes, if we are getting the best blastocyst, we can add the genetic testing PGT in cases of recurrent implantation failure. That will give us an embryo which is not only looking wise or the morphology wise the best embryo, but also the chromosomal normal. So that particular embryo which has been tested for the chromosomal abnormalities and is normal chromosomally should be put, and that is going to reduce the chances of recurrent implantation failure. Then, if we come into uterine factors, so in uterus, if there are some intrauterine pathologies like polyp or adhesions, then we need to do a hysteroscopy. We have to look inside the uterus and see if there is polyp, then that has to be removed. If there is some fibroid which is affecting the inner lining, then that should be corrected. And also, if there are adhesions, then that is broken, and then the endometrium is brought to normal as much as one can. If there is some kind of hydrosalpinx, or there is a fluid in the tube, then that should be also sorted out. So if there is hydrosalpinx, then either that is removed or that is being clipped, because the toxic fluid from the tubes does not trickle inside the uterus where we put the embryos. Then sometimes we need a good progesterone support, that is we provide after the embryo transfer. Sometimes we all have also seen antithrombotic treatment. That means we put on the heparin or ecosprin, which helps us in the help the implantation, sorting out the immune factors or any thrombogenic factors. Or in some cases, if there is a immunotherapy is required, which can be in the form of steroid, or it can be infection. If we find that there is an infection, then a long standing course of antibiotics is given. So after looking into whatever the problem in that particular patient is, we sort out and we do the treatment. The third, which is most important, is that implantation window. If we find that implantation window is deranged in that particular patient, that means when we are putting the blastocyst, for example, the endometrium is not receptive for that particular embryo for that day, but it is deranged. So either we need a pre-transfer, or we need a transfer a little later. So that is what we test it by endometrium receptivity assay, which is usually done in cases where there is two blastocyst failure. So in all these cases, what we get to, what is important is that we look into the complex situation. We sort of individualize and personalize the treatment according to the cause, what we have found after the good thorough evaluation. These patients particularly are very psychologically upset because they had repeated failures. So very tender loving care is required, a good counselor and psychological support is required. In cases if we feel that the embryo is already sort of poor quality, then there are other options like donor uh, egg, which can be provided. And or in cases where there is very grade 4 Asherman syndrome, or the adhesions are too bad, then a surrogacy can be given. So a good evaluation in the beginning, and with a very compassionate and very lot of tender loving care is required, and depending upon the the cause, we give a very personalized treatment. So that is what it is in nutshell. If there are any questions, then we can go on with the questions. So I think if there are no questions, then we'll end this session, and thank you very much.